What's up, Medite here. Let's talk about the veins of the lower limb. In order to structurize the veins of the lower limb, we generally divide them into two systems, simply the superficial system and the deep system. The deep system consists of veins that accompany arteries. These are usually two veins and they go together with arteries. The superficial system consists of veins in the subcutaneous tissue, and they're unique for the venous system, so they don't go with any arteries. Simple, right? Now let's expand on this and start with the deep system of veins first. To make this easier, I'll go ahead and divide the veins again into the veins of the thigh, the veins of the leg, and the veins of the foot. The first vein we're going to see in the thigh region is the femoral vein. The femoral vein comes from the external iliac vein at the region of the inguinal ligament, just as it passes the vascular space. Then it descends medially to the femoral artery. Then we got the deep vein of the thigh, as you see here. The deep vein of the thigh lies deep on the posterior side of the thigh, so it collects blood from the internal and the posterior surface of the thigh, as you see here. And once it collects all the blood, it empties them mainly into the femoral vein. The next vein is a continuation of the femoral vein, called the Popliteal Vein. It's very similar to the arterial system. So, as you see here, it's located in the popliteal fossa and then goes up to the adductor canal as the femoral vein. Distally, it becomes the anterior and the posterior tibial veins, but these are veins of the legs, so let's go ahead and look at that. So the main veins here are the anterior and the posterior tibial veins, which both come from the popliteal vein. So the popliteal vein splits and becomes these two veins. And I try to be creative here, but keep in mind that the posterior tibial vein lie on the posterior part of the leg, and the anterior tibial vein on the anterior side. The third deep vein you will find in this region is the paired fibular vein, which descends behind the fibula. And as you see here, the deep fibular vein is a tributary of the posterior tibial vein. So the posterior tibial veins descend and turn to the sole of the foot behind the medial malleolus. Now keep in mind that you can always go more detailed than what I'm showing you, but I want you all to gain a general picture of the veins of the lower limb to ease you all on this topic. So to review, the posterior tibial vein lies posterior to the medial malleolus in the ankle, and then it ascends. The fibular vein lies posterior to the lateral malleolus in the ankle, and then it ascends to empty into the posterior tibial vein. So these two are posterior. The anterior tibial vein lies on the anterior side. It originates and receives blood from the dorsal venous arch on the back of the foot, or the dorsum of the foot, and then it ascends to empty into the popliteal vein. Alright, I hope this made a little sense. Now let's go ahead and do the veins of the foot. These veins are very similar to arteries, and we will divide those into the dorsum of the foot and the sole of the foot. On the dorsum of the foot, and now I'm only covering the deep veins or the most profound veins, you will find the dorsal veins of the foot. These veins drain a network of superficial veins on the dorsal side of the foot and pump the blood into the anterior tibial vein. And remember, these deep veins always go together with their corresponding arteries. So the dorsal vein of the foot go together with the dorsal artery of the foot, or the dorsalis pedis artery. Then, just like the arteries, we got the dorsal digital draining the toes, and the dorsal metatarsal veins draining the metatarsals and structures around this region, and they pump the blood into the dorsal veins of the foot. This will make a little more sense in a minute, I promise. On the sole of the foot, the posterior tibial veins will split into the medial and the lateral plantar veins, as you see here, and they will form the deep plantar venous arch, as you see here. And the deep venous plantar arch will receive blood from the deep plantar metatarsal and the deep plantar digital veins. It's kind of straightforward at this point, isn't it? Let's now go ahead and cover the superficial veins of the lower limb. And remember, they lie superficially and they lack corresponding arteries, so they're special for the venous system. And the first one is the great saphenous vein, as you see here. It passes on the medial side of the foot in front of the medial malleolus, and then continues on the medial side of the calf. On the thigh, it passes through the saphenous hiatus in the fascia lata and then empties into the femoral vein. Now, this is a thick vein, so it has tributaries, and the first ones are the accessory saphenous veins, as you see here. These veins drain the superficial part of the thigh into the great saphenous vein. Then we got a vein that drains the anterior wall of the abdominal cavity, the superficial epigastric vein. We got the superficial circumflex iliac vein, which passes along the inguinal ligament and drains the regions around the anterior superior iliac spine. And then we got the external pudendal vein. This one is external, so it mainly drains the external genitals, so the superficial parts of the testes and the penis for men, and the superficial parts of the labials and the clitoris for women. Alright, so that was the great saphenous. Now, since we have a great saphenous, we gotta have a small saphenous vein as well. And this one goes mainly behind the leg, as you see here, better represented here in purple. It ascends along the posterior side of the lower leg, and then it opens into the popliteal vein, so it mainly drains this area. It also has some accessory branches communicating with the great saphenous vein. Awesome. Now next, we got the dorsal venous network of the foot. This one is relatively straightforward. It's just a network of superficial veins on the dorsum of the foot. So it drains the skin and the subcutaneous tissue of the dorsal side of the foot, and it forms an arch called the dorsal venous arch of the foot. Now, what's unique with this arch is that this arch forms the great saphenous and the small saphenous veins, and it does that through the medial and the lateral marginal veins, as you see here. So the medial marginal vein starts off at the dorsal venous arch, then it passes along the medial margin of the foot on the dorsal side, and then it continues as the great saphenous vein. The lateral marginal vein also starts off at the dorsal venous arch, but then passes along the lateral margin of the foot and continues as the small saphenous vein. So that was all the essential veins you need to know regarding the venous drainage of the lower limb. Remember that the deep ones go together with arteries and the superficial ones are special for the venous system. Now the following video will be about the portal venous system. If you found this video helpful, I would really appreciate it if you comment, like and subscribe. See you next time.